Good day, everyone. My name is Blesilda in Borja. I'm here to present my topic, which is Module 7 Sexual Selves. Okay, first, what is sexual self? Concept defined as an individual's evolutions of his or her own sexual feelings and actions is proposed as an important predators and contraceptive behaviors among teenagers and skill pleasurings and conceive as described. Also refers the totality of oneself as a sexual being include positive and negative concept and feelings. Let's go for the sexual development. What is sexual development? Puberty is the process as a physical changes through which a child body matures into a adult body capable of sexual reproduction system. Human reproductive system. The tissues, glands, or organs involved in production offspring children. In women, the reproductive system includes the ovaries and the fallopian tube, the uterus, the cervix, and the vagina. In men, includes the prostate, the testes, and the penis, enlarge and autonomy of the female reproductive system. Sigmund Freud. During the five physiosexual stages, which are the oral, anal, phallic, latent, and genital stages, the erogenous zone associated with these stages serve as a course of pleasures. If these physiosexual stages are completed successful, a healthy personality and the result. The human reproductive system. Human reproductive system. The tissues, glands, or organs involved in production offspring children. In women, the reproductive system includes the ovaries and the fallopian tube, the uterus, the cervix, and the vagina. In men, includes the prostate, the testes, and the penis, enlarge and autonomy of the female reproductive system. The human sexual responses to sexually occurring stimuli is a motivational, incentive-based circles comprehending subjective experience and physiologic changes. Clinical and empirical data support the circular models of overlapping bases of variable order. Brain imaging data of sexual arousal identity areas and cerebral activations and inhibitions, reflecting a complex networks and connective motivation, emotionals, and autonomic components. Physiologic and biologic factors influence the brain's appraisal and processing of sexual stimuli to allows or disallows subsequent arousal. The sexual and non-sexual outcomes influence motivations to future sexual intimacy. Variability is a mark both between individuals and within a personal sexual life, influenced by multiple factors including stages of life cycle, mental health and relationship happiness. Human sexuality. Human sexuality is the way people experience and express themselves sexually. This involves biological, erotic, physical, emotional, social, and spiritual feelings and behaviors because it is a broad term with a varied with historical context. The, the circles of sensuality. Sensuality involves our level of awareness, acceptance, and enjoyment of your own others' bodies. Intimacy is the degree to the which express which have need to closeness with other persons. Its components are caring, sharing, licking, loving, trust, vulnerability, vulnerability, self-disclosures, gender and sexuality diversity, GSD, or simplified sexual diversity, refers to all the diversities of sex characteristics, sexual orientations, and gender identities without the need to specify each of the identities, behaviors, or characteristics that form this plurality. Sexual orientations: a person's emotional and sexual attractions to others. It can change and may or not be the same as the person's sexual behaviors. Gender or gender identity: a person's internal sense of identity as a female, male, both or either, regardless of their sex. Gender expressions as the person's sexual behaviors. Gender or gender identity: a person's internal sense of identity as a female, male, both or either, regardless of their sex. Gender expressions: how a person express their gender. This can include how they look, the name they choose, the pronouns they use, and their social behaviors. The sexual intercourse, also called coitus and copulations, reproductive acts in which the male reproductive organs in humans and other higher animals, either the female reproductive tract, if the reproductive act incomplete, sperm cells are passed from the male body of into female. In the process, fertilizing the female's egg and forming a new organisms. In some vertebrates, such as fish, eggs are lodged outside of the body and fertilized internally. The premarital sex is a sexual activity which is practiced by people before they are married. In some period of human history, in some societies, premarital sex has been considered a moral issue which is taboo in many cultures, and it is also considered a sin by a number of religions. But since of sexual revolution of the 1960s, it has become accepted by certain liberal movements, especially in Western countries. Sexual transmitted disease or STDs, or sexual transmitted infections or STIs, are infections that are passed from one person to another through sexual contact. The contact is usually vagina, oral, or anal sex, but sometimes they can spread through other intimate physical contact. This is because the some STDs like herpes and HPV are spread by skin-to-skin contact. What causes sexually transmitted diseases, STDs? STDs can be caused by bacteria, viruses, and parasites. Who is affected by sexually transmitted diseases? Most STDs affect both men and women, but in many cases, the health problems they cause can be more severe for human. In a pregnant woman has a STD, it can cause serious health problems for a baby. Fourth, what are the symptoms of sexually transmitted diseases, STDs. STDs don't always causes symptoms or many causes mild symptoms. It's possible to have the infections and not know it, but you can still pass in the other to other. How sexually transmitted diseases diagnosed. If you are sexuality active, you should talk to your health care provided about your risks or S for STD and whether you need to be tested. This is especially important since many STDs do not usually cause symptoms. Some STDs may be diagnosed during the physical exam or through microscopic examinations of sore or fluid swelling from the vagina, penis, or anus. Blood tests can diagnose of other types of STDs. What are the treatment for sexually transmitted diseases? Antibiotics can treat STDs caused by bacteria or parasites. There is no cure for STDs caused by viruses, but medicines can often help with the symptoms and lower your risk of spreading the infections. Can sexually transmitted diseases, STDs, be prevented? Correct usage, the latex condoms greatly reduce, but does not completely eliminate the risk of catching or spreading STDs. If your partner is allergic to latex, you can use polyurethane condoms. The most reliable way to avoid infection is to not have anal, vagina, or anus or oral sex.